There are many things we can do to dismantle mental health and substance use-related structural stigma. We asked people to share some insights on how we can dismantle structural stigma. This is what they said. Measuring structural stigma. Thomas Ungar.
So it could be something as simple as, what's the wait time to see a mental health provider? We do that for cancer care. We might do that for hip and knee surgeries or cataracts. We don't do that for mental health. And that's why measuring it's really important, because that it gets counted, it gets addressed, and it can get attended to, and it can leverage change and improvement, and sometimes resources.
Integrating lived experience expertise. Mike Harrell.
Channel is an organization totally run by people with lived experience from the board right on down to the frontline workers. So that has made it easier for me to come out and say, this is what my lived experience has been like. It's like any project, bringing people on to a project that have the experience, the knowledge, and the background. That's the only way a project is going to be successful. So when it comes to structural stigma, we need to involve the people that have that experience, that know what it's like to be there.
Rehumanizing healthcare. Javid Sukera.
So the existing healthcare system, I think over time, has created a culture where many of the health professionals who work within it are essentially encouraged and taught to disconnect from their humanity as part of their training. And I think that comes at great cost, both to the health professionals working in the system, but also to the people who need help from the system. Because I think, as anyone who's sought care knows, the quality of care is greatly enhanced when the person you're talking to is an authentic human version of themselves, and not a robot or a cog in a machine. Rehumanizing is the transformative moment when you tell someone who works in the system that they aren't and don't need to be perfect. That moment where one can recognize their humanity is their superpower is exactly what we need to start to change the system and move us forward.
Education and policy change. Mike Harrell.
We've got a lot of frontline workers and a lot of managers that are trying to do their very best to educate themselves and to provide empathetic and supportive mental health services in our provinces. Often, they are not getting the support that they need or the tools that they need from their management, and that management is often not getting it from maybe people that are in government. Putting the policies and procedures in place that will allow people with lived experience to get involved. We're very fortunate here in Newfoundland that all the political parties got together and set a mandate with 54 recommendations that no matter what party was in power, that mandate was top priority, and it didn't change. So that's important.
Identifying structural barriers. Thomas Ungar.
When they come to emergency room, do they get equitably treated? Do they get same access to a physical examination? Do they have the same outcomes? So really, we know the patient care journey, and we know how to draw it, map it, and measure it in every other disease state. If we do the same thing, you'll see where those structural barriers are. They're really pretty easy to map out, and then you know where you can intervene to improve things.
Courage, compassion, connection. Javid Sukera.
We need courage to recognize that in the current system, stigma is baked into every aspect of what we do. It's the norm. So it takes courage to speak up against the norm. And that means that we have to be willing to tiptoe outside of our comfort lines, but respect the fact that not everybody draws the same line. But we also need to have the courage to be vulnerable the courage to be open and to demonstrate through role modeling the kind of way we can be in a future system. And of course, we need to have compassion, seeing one another not as labels or stereotypes, but as complex, nuanced human beings. But we also need to have compassion for ourselves. We can be so hard on ourselves. We can easily fall into cycles of self-blame and self-criticism. So we need to be better at practicing self-forgiveness, at remembering that we will stumble, but that doesn't mean we can't move forward.
mentalhealthcommission.ca